Good afternoon and welcome to the North Carolina Center for Afterschool Programs webinar. My name is Sharonda Witter and I'm the manager of the North Carolina Center for Afterschool Programs, also known as NCCAP. We are delighted to have you participate in our webinar today on health, particularly child obesity. So some of you may be aware that September is actually National Childhood Obesity Awareness Month. Bringing awareness to this topic provides us all with an opportunity to learn more about this health concern for our youth. 1 in 6 children that are school-aged nationally between the ages of 6 and 19 are obese. That is a startling statistic. And there's so much that we can do as after-school providers and summer program providers to combat this issue for the youth that we serve. And that is why we're here today. So our agenda, we have some phenomenal presenters that will be sharing their expertise on this topic with you today. First up, we have Keith Poston from the Public School Forum, who will be discussing the Roadmap of Need. Next, we have Cynthia Irvin from the North Carolina Department of Public Instruction, who will provide an overview of childhood obesity. Next, we have Cherie Vodica from the NC Alliance of YMCAs and Capri McDonald from the North Carolina Department of Health and Human Services, who will collectively review the NC Healthy Out of School Time, or NC Host Recognition Program. Lastly, we'll have Michelle McKinley from Advocates for Health in Action share their toolkit that they utilize in Wake County. At the conclusion of the webinar, we will have time for questions and answers of our presenters. So a little bit of housekeeping. If you are having any difficulties with the webinar, it may be important to close out some of the programs that are running alongside with the Zoom application. So close out any programs that may be causing technical difficulties. If you have audio difficulties, keep this number handy. You can dial in on your telephone and still be able to keep up with the webinar if you have audio problems. And if you have any questions, comments, or concerns, you can write those in the chat window and we will respond promptly. And again, we will have a time frame for questions and answers at the conclusion of the webinar. Whenever you see this screen, that means that we are changing presenters, so don't worry. The video may go black, but we'll be right back with you. So without further ado, we will start with Keith Poston from the Public School Forum.
All right. Thank you, Sharonda, and thanks for putting this together. This is it's an important topic, and the Center for After School Programs is an important initiative that we are proud here at the Public School Forum to have as part of our organization and something that is housed here. Just a few words about that part of it, actually. The Center for After School Programs is the reason why we are involved in it as the Public School Forum of North Carolina. Yes, we are primarily focused on K-12 public education, but we recognize that the after school and out of school time is critically important as part of overall learning. And so it's something that we've been involved in for a number of years and are glad to continue to be a partner. I was asked to talk a little bit about the Roadmap of Need, and this is one of the things that as a publication that we started putting out in 2010. It's a joint publication of the Public School Forum and NCCAP. It uses data in under 4 areas, key indicators, if you will: health, youth behavior and safety, education, and economic development, to assess the relative well-being of young people living in each of North Carolina's 100 counties. It has a lot of great data. We have that publication available on our website, on the forum website, as well as the NCCAP website that you can download in PDF form. But there's just lots of good information if you are in one of your counties to really understand, what the experience is for people living in the county. And the reason why we developed the roadmap in the first place was and looked at these areas is because I think we've all heard discussion recently talking about things like whole child and sort of how you approach education. We recognize that just what happens within the classroom is affected by things like what the home life is like, what the community is like, what's going on around those children. Are there jobs available? All the different things that that can affect a child. And so the Roadmap of Need gives us an ability to sort of hone in and say, where are there some areas of greater need and where are there areas where children are less likely to succeed? One of the exciting things that we've heard from the field, those of you who are after school programs who are tuning in today, is that they've been able to use the Roadmap of Need in funding requests. You talk to a foundation or local government or state government and say, well, my organization, let's use this one as an example, health. If you have programs that really are focused on health and wellness, and your county happens to be in the bottom quartile in terms of health environment for children, it's something that you can use to say we're specifically addressing that. So, but the whole purpose of it, just like the work that we do overall at the forum, is to make sure that every child has every opportunity to succeed, and that their outcomes are not solely driven by where they happen to be born. So, with that, wait a second, let me move forward. So these were the I was supposed to click ahead and I did not. So these are the different categories: economic development, education, health, and youth behavior and safety. And as you can see, there's data points under each one of them that you can pull out. And again, one of the things that has been useful is, again, to drill down on specific things that you can then use to talk about your program and to promote it to funders as well as the community and parents and others who are looking to bring kids in. The roadmap of need itself does go down as a 100 county ranking. If you look at this chart that's on your screen now, we break them up into quartiles, and probably no surprise to those of you who are from North Carolina, or perhaps maybe you are calling in or tuning into the webinar from Eastern North Carolina, that some of the biggest pockets of needs are in areas east of I-95. Really, most of Eastern North Carolina falls into the quartile 4, meaning that those counties, in a combination of those 4 things, all fall in the bottom 25 of North Carolina's 100 counties. In fact, I heard this statistic a few years ago, and I don't think I'll ever forget it. If you take and I grew up on that side of I-95. If you take I-95 and it cuts across North Carolina, and were to cut it in half and make that part of the state, the Eastern North Carolina part of the state, the 51st state in the country, it would be the 51st poorest state in the country, and it would also be the 51st most unhealthy state in the country. We follow the education rankings, things like school performance grades, which we don't particularly care for, but they exist. Standardized test scores. If you look at school performance grades and standardized test scores, I've often told legislators that we could save a lot of money on your school performance grades because we could just lay over where poverty is a problem in North Carolina, and it would pretty much match up with all your DNF schools in North Carolina. Again, because of the same kinds of issues that we highlight in the roadmap of need. It's not just what's going on inside the school, it's what's going on around the school. So it's a useful document. I encourage you to take a look at it and to reach out to us. Feel free to reach out to me directly or reach out to Sharonda and can help you understand a little bit more about the roadmap. With that, we are moving to our next speaker.
Hello, everyone, and thank you for attending this great and important workshop. So today we're going to be talking about childhood prevention. So when we look at this screen, there's many things that actually go into looking at health. And when we look at physical activity, we're looking at fitness. That would include physical activity. Diet, that would include the eating habits and what we include in our day-to-day life. And then the balance is balancing all of those things to come up with prevention. So this first slide that you see right here is a slide that is actually taken from the Academy of Nutrition and Dietetics. And I really like this because it really gives a real insight on when it comes to childhood obesity, some of the things that actually impact. So food insecurity happens to be a huge part of childhood obesity and overweight. So why is that? It's because most families who are insecure lack the access to healthy foods. Typically, they're really stressed. They're stressed about things like housing and finance and healthcare and a number of other things. But oftentimes they choose calorie-dense foods rather than the nutrient-dense foods. And sometimes they do that just because they're less expensive. So in the past, it has been more of a visual that typically when a child was food insecure, they would look frail or tiny. Well, not so much in this world today. So if you look at this slide, you will see that food insecurities and being obese are two of the biggest crises facing American children today. But they don't need to be, so the solution actually really is in the understanding and the need for each of us to work toward trying to prevent it. So right now, nationally, there are about 16 million children that are food insecure, and there's 23 million that are overweight. So I think you can see the alignment with where we're going with this. So looking at lifestyle factors. So childhood nutrition and obesity actually has something to do with the way our lifestyle. So just as it is important for our adults to make healthy and smart lifestyle changes, so does the same thing need to happen with children. So when we look at this, there's a lot of strong studies that actually talk about the combination of children and the amount of time they're doing screen time, exercise, sleep, hygiene, and coping skills. So here, I think most of you are aware of all the chronic diseases that are associated with childhood obesity. So anywhere from heart disease down to depression and low self-esteem. So poor nutrition, just as Mr. Poston said, it equals poor learning. So irritability and behavior problems are just one of the things that happens. In fact, we see a significant amount in schools where teachers and principals spend an enormous amount of time redirecting students because they have difficulty concentrating and performing complex tasks. They have low energy levels. They're more ill and miss more school days. They have reduced brain function, and also lower standardized test scores. So we want them to eat smart so they can be ready to learn. So we have a lot of studies that show that when children are receiving meals, they are more prepared for school and they can take advantage of many school opportunities. So we want them to move more as well and learn more. So that helps to increase their concentration. It increases their math and reading test scores. It reduces behavior and improves mood and enhances positive attitude. And again, because of physical activity, it actually reduces absenteeism. So speaking of whole child, so this is a relatively new addition to the Department of Public Instruction, where the school and healthy support services actually looks at the whole child and all that would go here. So the point that I really want you to take away from this is look at everything that surrounds this child: health, safety, engage, support, and challenge. So when we look at this, the child is the star of the show, and we all should look for ways that we can continue to make sure that a child is the star and we're doing all we can to give them a healthy beginning and end. So now I wanted to just introduce you to some possible solutions. So we already know that there's school breakfast during the school year, there's National School Lunch Program, there's school and after-school snack programs, there's the at-risk after-school program, and the summer nutrition program. So school meals will make a difference. So it is definitely known that the National School Lunch Program and the School Breakfast Program has incorporated some great nutrition standards that really focus on low-fat milks and more fruits and vegetables and serving fewer sweet drinks. And children happen to gain less weight when they are in school. So of course, breakfast is just as they say, it is definitely one of the most important meals, and they all, again, help with all of the issues that can affect a student while they're in school. So the next one is the Child and Adult Care Food Program, which is also the at-risk after-school program. This is a great infographic that actually provides some great and healthy guidelines that you might use in your after-school programs or summer meal programs. And so you can incorporate those as well. So the summer meals program, which happens to be my favorite, is the program that I actually administer, but I do want to just mention they have great toolkits. It's called the Summer Food, Summer Moves. And that toolkit can actually provide a lot of information for you and your families. So in the toolkit, you will see that it has like themed nutrition activities, there's physical activities, there's age, according to the age groups, there's family handouts, and then there are kid-friendly recipes, which is always a nice tool. So in this tool, you will find that there are posters and flyers and recipes and placemats and all kinds of activities. And it is absolutely free to you and everyone else through Team Nutrition. So here are just some other resources that are also available for free. And again, it's at Team Nutrition. So how do you build that healthy plate? So I went back and really just went back to the nutrition guidelines, the dietary guidelines of 15 through 20. So pretty much you just need to have a variety of vegetables, all the subgroups, using whole fruit and rather than juices. Also service of half your grains as whole. Choose low fat or fat-free dairy products. Serve a variety of lean proteins and meat alternatives such as beans, and make water available. So sodium and also making sure that you limit sodium and solid fats and additional sugars. So because Summer Food Service Program is kind of my baby, I wanted to make sure you had an opportunity to look at this meal pattern because the Summer Food Service Program is not a program that has a lot of requirements as far as nutrition. It is a summer food service program. So I challenge you all to use everything that we've talked about in this webinar today to implement in your program when you're operating during the summer. So I just wanted to put that there just so you can see what they are, but please go back and try to incorporate those guidance that we talked about from the dietary guidelines. So now that we have went over all those things, and there's far more things that we can talk about, but I wanted to just give you something to ponder. Do you really believe that our children are our future? If so, you have a huge opportunity to impact the nutrition well-being of the children you serve. Remember to provide balanced, nutritious meals, physical activity, help create healthy habits, and promote positive lifestyle changes as the first line of defense of childhood obesity. Thank you.
Well, hi, everybody. My name is Cherie Vodica, and I'm the Executive Director of the North Carolina Alliance of YMCAs.
And hello, I'm Capri McDonald. I'm with the North Carolina Department of Health and Human Services, the Early Care and Education Childhood Specialist.
So Capri and I are going to share a little bit with you about how you can get some recognition for making sure that kids who are in your out-of-school time programs, who are eating healthy food and getting plenty of physical activity, how you can get recognized and market and promote your services as a wonderful, healthy out-of-school time provider using this program. So first, a little background. Back in 2009, the Robert Wood Johnson Foundation provided some funding to the University of Massachusetts in Boston and the YMCA of the USA, and they co-founded the Healthy Out of School Time Coalition. And this coalition then recruited a lot of members, and you can see there's a very large list of different organizations from Action for Healthy Kids to the Afterschool Alliance to the Forum for Youth Investment to United Way. All of these different partners came together and worked together to create some standards. So the first charge that they were asked to complete was to create a set of evidence-based healthy eating and physical activity standards, or HEPA standards, that could help foster the best possible nutrition and physical activity outcomes for kids who are in grades K through 12 who attend out-of-school time programs. That could be before school, it could be after school, it could be during the summer. And the fun fact about this is that here in North Carolina, we have some extra, we have something to be extra proud of, and that is that North Carolina's Move More standards for after-school physical activity were used as the basis to set those evidence-based standards for physical activity. So that's a specific point of pride for us here in our state. And some of you may have been on that group. So after the standards were completed, they were adopted by a number of national organizations. And again, the National Afterschool Association, which this NCCAP is a part of, the YMCA of the USA, the Council on Accreditation, the National Recreation and Park Association, Boys and Girls Clubs of America, and the Alliance for a Healthier Generation. All of them adopted these HEPA standards. So here in North Carolina, we decided to try to do some work to encourage more after-school programs and out-of-school time programs to provide healthy snacks, healthy meals, as Cynthia alluded to, and then also to make sure kids get plenty of physical activity. So we got some grant funding from YMCA of the USA, and they hired the Public Health Law Center. And the Public Health Law Center did an analysis of all of our early care and education and also our after-school program laws that were on the books as of 2010 or 2011. And what they found in their study was that we have really good standards here in North Carolina, but that there was an opportunity for us to create a statewide voluntary healthy recognition program that would perhaps be a promising practice to really encourage and motivate out-of-school time programs to adopt these standards. So we went to work and found a couple of lawmakers here in North Carolina, the General Assembly, who are really committed to and interested in making sure that our children are as healthy as they can possibly be. So we worked with Senators Daniel and Gunn on the Senate side, and we worked with Josh Dobson, Representative Dobson, on the House side, and we crafted a couple of bills that would establish the Healthy Out-of-School Time Recognition Program. And so you can see a picture of some of those lawmakers in this picture. And what the bill language said was that the Department of Health and Human Services, which Capri is a member of the staff there, and the Center for After School Programs would work together to develop a process that would be hosted on a website. And we're going to show you that website here in just a minute. They were to create a certificate, and they were to talk about where and when and how programs would be able to be identified as health out of school time sites. It required that parents be engaged and informed in the process, and that we establish a length of the validity of the certificate once it was earned, and that the department would also put on the website a list of all the programs that met the Healthy Out-of-School Time Recognition Program standards. And so before we rolled out the standards, we convened stakeholders from all of those groups you mentioned, that we mentioned earlier, recreation, 4-H, the Department of Public Instruction, and others, into a room, and we looked at some standards, and we decided to adopt the Alliance for a Healthier Generations standards. And so Capri now is going to jump off and tell you a little bit more about those standards and how to apply.
Thank you, Cherie. So listed here are the 11 category of standards for the Healthy Out-of-School Time program. These 11 categories are within the framework developed by the National Afterschool Association. These are best practices as they relate to healthy out-of-school time options for programs. They look at both healthy eating as well as physical activity. If you take, for example, healthy eating 01, snack, meal, and drink quality. It addresses the quality of snacks, meals, and drinks that are provided by health out-of-school time programs. For example, looking at best practices of items that are serving fresh fruit, not canned or frozen water, and 100% fruit, 100% juice. This is also a look at a physical activity, addressing physical activity 01, addressing whether or not after-school time programs provide the recommended 60 minutes or more of physical activity to children enrolled within the program. I would like to also mention that the categories listed can be found are part of the NC Host assessment. The NC Host is partnering with the Alliance for Healthy Generation to assess if programs are eligible for recognition, and I'll talk a little bit more about that later. Here's the website for the NC Host program. This website is located on the Eat Smart, Move More North Carolina webpage. Within this webpage, you can find information regarding the eligibility requirements for the host program, how to apply, background information, which is some of the information that Cherie provided earlier on the legislation, the assessment, resources to meet the standards, as well as the list of programs that have qualified and are now recognized as host programs. Here is an example of the Alliance for Healthy Generations out of school time webpage. The Alliance for Healthy Generation has helped the host with providing resources to healthy out of school time programs. By visiting this website, you can find a list of resources for training opportunities, activities related to physical activity, as well as nutrition related recipes and ways to get youth involved or engaged with eating healthier and being more physically active.
So this is a set of resources that were developed to help out of school time programs promote and know more about this. So we have a one-pager, which is the one with the pear on it that's up in the upper left-hand corner of your screen. And that is just a one-pager that describes the Healthy Out of School Times program so that you can share that with the people that you work with so that everybody's on the same page about what you're trying to do. And that is downloadable on the Eat Smart, Move More website at the host page that Capri showed you. The second handout is the actual list of all of the standards broken down by each category that Capri shared. And the third handout, which is the one on the right-hand corner, is a letter for parents. And it's a template that you can use to modify so that you can share with parents who are coming to your program that you're trying to strive to be a healthy out of school time program and how they can really help you. And lastly, we have a certificate, and the certificate is not on the website, and here's why. Because you do have to go through a process of doing an assessment using the Alliance for a Healthier Generations website assessment. And once you've completed that, we just have a short form on the Eat Smart, Move More website for you to complete so that you can get your certificate of recognition. But this is a great way for you to hang this in the hallway, in the halls of your program, and let everyone know that you are recognized as a healthy out of school time program. I also wanted to share that the National After School Alliance has recognized the North Carolina Center for After School Programs and all the partners who worked on this as most influential in health and wellness for 2017 for all of this work. So we're very excited about that, and we're really hoping that you will take advantage of the opportunity to have your program be recognized. And here's our contact information in the event you have questions. Thanks.
Good afternoon. I'm Michelle McKinley, Project Coordinator for Advocates for Health and Action, and I'm happy to be joining everyone here talking about tools for reducing and preventing childhood obesity. And I'm really excited that so many after-school providers are interested in knowing what they can do to be part of this solution. So first, just a bit about what AHA's mission is. We improve the health and well-being of Wake County residents by facilitating and supporting community initiatives. And we do that by bringing together partners focused on changing policies, systems, and environments that bring well-being, healthy eating, and physical activity to the forefront. And so we do have a collaborative of partners across the county, and we were founded upon evidence-based practices, and that continues to inform our work. And I mentioned these partnerships that we have. There are more than 75 organizations, and there are 12 municipalities in Wake County, including Raleigh and Cary and a number of others here. And the town managers, parks and recreation departments, planning staff, others who are involved in the town business, as well as elected officials and county staff and officials, a variety of nonprofit associations, as well as businesses and other advocacy groups. And of course, youth-serving organizations such as the YMCA and Boys and Girls Clubs and Parks and Rec departments that offer after-school programs. We all have a mission that intersects in some way. We're all focused on increasing healthy lifestyles in Wake County. And so we're doing that together. We take an evidence-based approach of policy systems and environmental change because we know that obesity and health problems are influenced by policies and environments that encourage one behavior over another across a large population. And we know from research that major health problems are not going to be solved by individual actions and choices. And we also know that long-term positive health outcomes come with policy systems and environmental change. So NCCAP had asked me to talk about some of the items in AHA's toolkit. This graphic that you see here is one that's on our website, and I'll share the address with you in a couple of slides. And I'm going to share with you just about 3 of those tools in the toolkit today that's available to every organization, and in particular can be of value to after-school programs. The first one I'm going to talk about is our Safe Routes to School in Wake County Toolkit. This was developed through partners who were coming together, focused on how we could increase the number of children walking to and from school or biking to and from school on a more regular basis. So not just having, the International Walk to School Day in the fall or the Bike to School Day in the spring, but increasing those efforts so more students would be moving more often. And so, again, I mentioned, we brought partners together who were all focused on this. We had some local representatives as well as some national Safe Routes to School representatives working with us on this. And we decided to do a survey, and we were not able to do that through the school district to principals, but we were able to reach PTA representatives and presidents through our partnership with Wake County PTA Council. So I mentioned that because it's important to keep those partnerships in your own communities in mind. So we wanted to find out, why are they not walking and biking to school if that's the case, or why are they not doing it more often? And so what we found from the survey results was really there might have been some specific individual reasons based on where their school was located, on the street, and different infrastructure issues, but largely there were really common barriers among these schools. So rather than reinvent the wheel, we wanted to provide a resource where we were bringing together and narrowing down the many, many resources. If you've ever looked at active transportation and Safe Routes to School materials online, you have seen there are a wealth of materials out there. And it can be really overwhelming if you're trying to figure out where to start. So our goal was to provide a resource for schools and organizations in Wake County where that wouldn't be quite so overwhelming. So we did a literature review of materials out there already. And we separated our group into people who would focus on each of the barriers that we had identified that were holding people back from doing more safe walking and biking to school. And in that literature review, everyone chose 1 or 2 of the materials they thought that were the most useful and the most user-friendly, and tended to be the shorter ones. And we pulled those together into the toolkit and created the toolkit with sections for each of the barriers. And our thinking there was simply that if you wanted an overall resource, you could have that tool, or if you were really only looking for expertise in one area, you could go right to that section, whether that would be walking school buses or park and ride programs. And then we also wanted to include some specific Wake County information for our schools and programs here in Wake County about when do you contact the school district for support in making a change versus when do you contact your municipality, because that's a lot of schools had questions about that. who to contact when. So the result is what we have here. The cover on the screen there is the cover of the toolkit. And it's now a manageable resource with Wake County information that's available for free on our website. And Active Routes to School Region 5, which Active Routes to School covers, or Region 5 covers 5 counties, including Wake County. And they partnered with us on this and provided funding to print a number of toolkits. So it's possible that there might still be some printed copies out there that you could get, but it is available on our website. And the next step that our partners agreed on was, well, how do we roll this out? What do we do to let people know that this is available? So we decided to host a workshop to share the key highlights of what we found and how they could address these barriers they were facing. So we brought together a panel of local experts, some planners from local municipalities, for example, Apex, North Carolina, where we had a municipal planner who had been involved in a couple local schools' walk-to-school efforts, helping them with logistics and planning, also school system, transportation and planning staff, and of course, parents. And it really was a great collaborative process beginning to end, from figuring out as a group what could we do to increase walking and biking, and creating the survey and the toolkit and then the workshop. And so I share all of this with you because after-school programs really have a great opportunity to connect with schools. Many after-school programs, of course, are on-site at schools, and many others are not. So whether you're within the school or outside of it, you have opportunities to be part of these efforts at schools, whether you spearhead them or support the school. A couple of different examples on walk to school days. You could be hosting walk at school programs, whether that's before or after school, walking around the track at school, or walking in the gym if weather doesn't allow outside, or programs like Park and Ride or Remote Drop Off, where students might gather at a park or shopping center near the school and then walk together as a group with your organization. And that way they can participate even though they've been dropped off at school or are not able to ride a bus home or something. Another opportunity for after-school programs to partner with schools around safe routes to school is hosting a bike rodeo, where you can partner with law enforcement and other experts on bike safety and teach the kids how to do that safely. It's a lifelong skill. Also, bike pedestrian safety education. You have a great opportunity in your after-school programs to share that kind of resource and education. There is a free resource called Let's Go NC from North Carolina Department of Transportation that is available through our toolkit and online, and it's modules that are very easy to use that you could follow through a period of time. And you could support schools who are planning walk to school day events, for example. You could do those modules leading up to the walk to school day as an example. So I encourage you guys to check that out and see how you can partner with your schools. The second tool I'm going to share with you about is the Sports Snack Game Plan, and a companion piece, the Camp Snack Game Plan. In short, this was a resource that the first director of AHA felt a need for after being at her young daughter's soccer games. And as our culture has become one where there's just sugary snacks and drinks all the time after any event, she saw a problem with not that much physical activity happening on the field and then these snacks afterwards. So working with partners, this one-page resource that promotes fruit and water, or fruits and vegetables and water for refueling, for youth sports leagues. And then also the companion piece is the exact same information with just some different branding around camps. And again, that was created to be a turnkey solution that coaches could use for their teams and parents could have at their fingertips. Pediatricians signed on to the Sports Snack Game Plan, and that gave a lot of credibility to the effort too from the medical community. So the resources are this simple one-page flyer, and then the image you see there is artwork for a banner that is scalable to a variety of sizes, And there are also the opportunity to have an African American coach and a female coach on the banner. We have all of those available on the AHA website. And you can see there's a town of Cary is co-branded there with AHA's logo. That's an option for your organization too, if you wish. We can update that artwork and then you can take that and get that printed. It's all on the website. And this image is just one that shows you a very large banner hanging in one of the town of Cary gyms where their youth sports games are held and also where many of their camp programs are held. So they're reinforcing their messaging on a regular basis. And lastly, just to share with you about some holiday resources. Again, our partners joined together to create a couple resources for youth serving organizations that they could kind of have as practice, that they would reduce the amount of unhealthy food and snacks at all the holiday celebrations. As you all know, the holidays seem to come one after another. There's always reason to celebrate. And so these flyers are, again, free and available to you to use, and they have suggestions and ideas for other solutions, and some even involving movement. So those are all on AHA's website. I invite you to check it out and to subscribe to our monthly e-newsletter, Health in Action. Follow us on social media, and of course our contact information is there if you have any questions for us. Thank you so much.
So now we've come to the portion of the webinar where we'll answer questions that you all had throughout the duration. And so we did have one question. So the question is in regards to North Carolina Host. Do you see a large population taking advantage of these resources? So I'm going to defer to Cherie Bodica to answer that question.
So thanks for the question. I know at this point, because it's so new, we just started in April, we have had a number of sites go ahead and start the process. So we can see that people are in there answering questions in the survey. But we do recognize that there's a lot of questions, and that sometimes it takes a team of folks who work at that particular site to answer the questions. So we do know some folks are working on it, but right as of now, we don't have any host recognized programs in the state yet, but we're working on that.
Awesome, thank you. So we'd like to thank all of our presenters for sharing their expertise with us today. This concludes our webinar, and we want to thank all of you who took the time out of your day to log in to participate in this webinar. So these monthly webinars is something that we're hoping to continue with the North Carolina Center for After-School Programs, and as Keith mentioned, our topics are going to be centered on the roadmap of need. So for the month of October, we're looking to host a webinar on youth behavior and safety, particularly child abuse and neglect, and we like to focus on adverse childhood experiences, or ACEs. So please stay tuned to our After School Observer, or however you heard about this webinar today, to hear more details about when that webinar will occur in October. The presentation and PowerPoint that you saw today, the live recording, will all be on the North Carolina Center for After School Programs website, which is www.nccap.net. And that concludes the webinar. We hope that you have a wonderful day. Thank you.